Hi, this is Dr. Bill Wyatt with the American Orthodontic Society, and I wanted to explain some stuff about the temporal mandibular joint. And when I first start off here, I want to just show you the skull, actually a skull, and it is a skull, not a plastic one, and how the skull works and how the joint is so close to the ear. And I want to go in later and show you the thing actually operating. Okay, I want to go to a skull here and show you exactly what happened. It kind of fooled me. I had two of my molar teeth taken out on the right side, and that would be these two molar teeth right here on this skull. The lower 6 and 7, my wisdom teeth were removed before I started to dental school, and I had these two taken out on the right side, which would be the other side of the mouth. And I failed to think about what this would cause trouble with the temporal mandibular joint, but it certainly has. Now the muscle structure is right up, comes out all over the side of the head here and works up through here, and it attaches about in this area here and right in here, and it's back actually behind the teeth, except for maybe the wisdom teeth and part of the second molar. But when I had these two teeth removed, these bicuspids were taking the load when I chewed on the other side of the mouth, and I didn't think about the strain that it would take on the joint up here. If I move my jaw forward, I have to hold the skull, and that's what's. And when you go forward to bite something, these teeth have to separate in the molar and bicuspid area. And when I'm chewing over there, the only thing that was in contact with the bicuspids over here, and the muscle is pulling on this side, and that put a extra load on the joint up here. And I was not thinking when I allowed people to remove these two teeth were bad, but they could have been root canals and saved them if possible. I didn't want to have an implant, so I just made a little partial and put in here, but I don't wear the thing very much. And so when I'm eating, the load is held here and here, and the muscles are pulling the jaw up from this part back here, which puts an unusual load on these teeth, and also a load on the jaw joint itself in the video. So I'm going to go back and show you and go through that again later on. But I wanted you to see on a skull, you have some other things that we need to impress on people: the importance of the temporal mandibular joint. And this joint is part of the jaw, and this jaw has all the teeth in it and everything, so anything related to dentistry also is tied to the joint, and people should know more about it. And I explained that I had my molar teeth out on the right side of my mouth here, and I have a partial put in there, but I should have put implants, but I don't have that much longer to mess with implants, so I put a partial, and I don't like to wear it, so I go without it a lot of times. And while I'm chewing over here, there's no support for to put the force of the chewing up through the bone structure. It puts it onto the joint itself, and I was not aware of how this would affect the joint. And this is what I'm trying to get around, that if you do dentistry in anything, I mean restorative dentistry, surgical types of dentistry, and just put a filling in or make a tooth too thick in the backside, it can cause TMJ problems. And this old nonsense of saying that orthodontics has nothing to do with the temporal mandibular joint is just, it's wrong. It's really wrong. It does have it. I wanted to bring that point out. So I want to run over a healthy joint here this morning and show you what it does. Let's see if I can get something here to mark on it. I'll just use this little arrow. This is a healthy joint. Now this is the retrodiscal tissue. Let me pull this, if I can pull this joint back forward. And that's on the emphasis. It goes up here, and I'll stop it right there. Now, this part right here is what we call the retrodiscal area. Here is your disc. I'm going to see if I can mark on it. If I can draw on that. Okay. I can just take my finger. This is the condyle now, right here, and here's the fossa. And when you slide your jaw forward, this condyle is going to move out over here, and the disc, which is biconcave, now like this, coming in here, and it has attachments out here, it has attachments here and up here as you bring it forward. And this material in this disc is dense connective tissue that is so strong. I'm 94 years old and soon be 95, and the joint is still working good, and I still have a disc in between here. This has been working all my life in there. Now, there's so much pressure on this when you bring the jaw back out here, and now bite the teeth out here together. There's a long distance between here, and the muscle structure is back in this area, and it puts so much pressure on the center part of this disc that there's no blood vessels in there at all. They can't take it. There's no way to feed the tissue. It has to have some way to feed it. So it is a marvelous thing. This is the most complicated joint in the whole body. A retrodiscal tissue is formed back in here, which is highly vascular. And if you shove this condyle back too far and put too much pressure on this retrodiscal tissue, where you've got all the vascular food coming in and lubricant for the joint right there, and you damage this, or you get hit in the mouth and it damages this and it swells up, and you keep using it and you keep irritating it, then the pain from this temporal mandibular joint will go all over your shoulders, your neck, your head, and you'll have pain all around when you keep doing this. I'm going to try to erase all this now, and you can see where it is. Now the condyle, as it moves forward, let's see if I can move it here. I may have to press here. All right, there it goes. Whoops. I'm going to stop it. Whoops. If I move the condyle from here to bring it out to this point, it probably pulls loose from there. Let me see if I can move the condyle. That's with it. Let me see if it. Oh yeah, here we go. This is great. I'm going to erase this marking. All right. If I take the condyle, as the condyle, I'm going to move my teeth forward and bite on my front teeth, then I will move this out like that. And I stop when it gets out here. Now you see, this area is open back in here. Here is this this retrodiscal tissue is right back in this area. How does that fluid that is so important to the condyle get to it? Now you watch, the condyle doesn't go up in here, it just goes back along in here. It kind of squeezes that retrodiscal tissue as it finishes up the movement. And watch as it goes back up and it'll squeeze right in there. Now as long as it doesn't mash this tissue too hard, back there, then as long as it doesn't mash that too hard, then that squeezes this retrodiscal tissue, the fluid that feeds the condyle. Where you operate on somebody, if you squeeze this condyle up against, let's see if I can move that again just a little bit. Say you pull the jaw back to a certain point and you wire it up where this can't move for a long time. This thing keeps jumping back where it can't move. Then it can't, the retrodiscal tissue, that fluid that is the lubricant and also feeds this, the disc will actually die in this area. Now when it dies, it has no nerve endings, you don't feel it, but you'll find if you run through these videos, you'll see one of them in here which has got a big hole in the center of it, and that's when it got tied down and it couldn't get any food, and the tough material dies. And I've talked to oral surgeons where it's just like cheese or something. You can scrape it off of there, and so that happens. So I just wanted to show you that whatever you're doing dentistry-wise can have an effect on this jaw joint, and we need to know about it. And this is a healthy one. This is the way it works. And this is an excellent picture made by these men in Norway. They had to get somebody that just passed away and cut this down, and it would show you. You've got your attachments up in the high part up here, and then you have it attached down here to this. So I hope this will help some of you to understand, and I think in dental schools we ought to be taught how this works, and that dentistry is not separated from the temporal mandibular joint problem. Orthodontics has an effect on it. If you don't know what you're doing with it, you can affect the jaw joint in here. And if you put a crown on the tooth and it hits and shoves this condyle back further into this socket, it can cause problems in there. So that's what I want you to understand, that every dentist ought to understand some stuff about this temporal mandibular joint, how it survives, and this is a very tough thing, and it stays with you all your life if you take care of it properly. And I have an example of that fact, and I overloaded mine by letting somebody get these teeth out down here and not wearing the partial like I should. So I'm going to say goodbye and hope you get something out of this, and then you can just turn to this and it'll show you what that the healthy joint would do. It's got these double attachments in the back part, and then the muscle attaches out here. And if you get hit real hard, sometimes you'll pop this disc right out in front of you. So I'm going to say goodbye and thanks for watching. And I hope you'll join our little group here and subscribe to it. And we'll keep trying to put these videos out. And this goes to just anybody in the world that wants to watch it. And it would help understand what happens here. Thank you, and I'm going to say goodbye. And I'll close out and stop.